it's the sum total of these daily decisions that you and I make about the foods we eat, the time we have devoted to activities, our relationships, etc. So this is the type of holistic framework that I think becomes really important if we're talking about bending the needle, moving the arc on somebody's wellness arc.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Dr. Michael Doney, Executive Medical Director at Biograph. In this episode, we discuss Biograph's preventative health platform. Dr. Doney shares how his experience in emergency medicine shaped his approach to personalized, proactive care. Plus, we talk about translating diagnostics into outcomes and making longevity more actionable and accessible. Let's get into it. The Fitt Insider Podcast is presented by EGYM. EGYM's smart fitness ecosystem is transforming healthcare through exercise. Combining strength equipment with AI-powered software and corporate wellness platform WellPass, it's leading the shift to proactive preventative health. Learn more about EGYM's intelligent workout solutions at egym.com. Hi, Michael. Welcome to Fitt Insider. Thanks for joining us.
Thanks for having me. It's a pleasure to be here.
Yeah, lots to talk about today. And right from the top, why don't we get your introduction, tell us about yourself, and tell us what you're working on at Biograph.
Yeah, thank you. So my name's Michael Doney. I'm the Executive Medical Director here at Biograph. Biograph is committed to providing the premier preventive health and diagnostics platform. We're working currently and committed to revolutionizing the healthcare space. And we look to do this by combining best-in-class evidence-based diagnostics, a rather unique member experience, and then providing, again, sort of evidence-based, lifestyle-based interventions provided by a team of physicians, registered dietitians, and exercise professionals. We recently came out of stealth mode here earlier this year, and we're actively seeing members in San Mateo and New York City, and really quite excited about that.
Yeah, that was the kind of big, most recent announcement. And I think myself and maybe some listeners had kind of heard that, hey, there was this clinic and it was doing some of these preventative health things. There was a membership. And to your point, coming out of stealth mode wasn't, super public. How and when did you get involved? How long has this been going on? And then what was that transition from, hey, stealth mode, one location, maybe, to launching more publicly and expanding?
Biograph first began seeing members in 2020, and that was along about the time that I had joined. Previous to that, we had been co-founded along with Dr. Peter Attia, and with really a commitment to providing a means of personalized, proactive, preventive care. So since that time, when we began seeing members in 2020, we've really been working on refining the evidence base around our diagnostics, working to develop our results reporting, really working to flesh out our member journey. And like I said, this is a lifestyle-based intervention plan in concert with the physicians, our dietitians, and our exercise professionals, and really working to ensure that we're delivering really the best possible value. So with that then, and our San Mateo clinic, which I should mention is just right outside of San Francisco, and now most recently our New York City clinic, we've been rolled that out to and more general announcement and actively seeing patients, as I mentioned.
And you mentioned getting involved in 2020. Just maybe a little bit more about you before we get into the specifics. How did you come to this? What drew you to this? A little bit about your background and maybe this approach versus other paths through, whether it's medicine or seeing patients or the broader preventative health space in general.
Yeah, thank you. Well, I had for many years been practicing as a board-certified emergency medicine physician. Setting aside accidents and injuries, the majority of my work was really devoted to managing the acute care manifestations of chronic disease. And really, in that mode, a lot of what this care was, although gratifying, was really damage control. And I became increasingly aware that really the conventional care system was not, adequately managing the ongoing chronic care issues and really responding in a reactive mode. And I became increasingly convinced that really patients, all of us, deserve a more proactive, personalized, preventive care perspective. And just, I would say just in general in my medical career, that has been, certainly my perception. And so that really began the genesis, the movement of myself and the work that ultimately has resulted in me arriving here at Biograph.
When you talk about, really building, and I thought this was really interesting when the kind of initial launch information, and we covered that through the Fitt Insider newsletter and some content there, but just that it was a focus on preventative health, a focus on comprehensive diagnostics, not what we often see, is longevity, concierge, AI doc, like, AI assistant, but really this focus on diagnostics and prevention. What does that patient journey maybe look like? And maybe that even the kind of end-to-end membership experience.
Yeah, thank you. So our work with our members begins before they even step foot into the clinic. And that begins with a pre-visit call with a member of the medical team. And we're really looking to gain a deep understanding of our members' thoughts, their wishes, their approaches, to date around health span and their wellness journey, gaining insight into what exactly they're hoping to achieve, and that way, and then working with them to most optimally prepare them for their visit day. When they do come to see us, we provide a more high-touch, elevated experience. If you have to have a day of testing, we want to make this as pleasant as possible. And then subsequent to their encounter, and they'll meet the Biograph team, the Biograph physicians, and we'll, along with our medical assistants, kind of work them through their day. And then very shortly thereafter, they'll have their comprehensive results review with the Biograph physician. We go over their findings. We're really focused on integrating the results of the diagnostic testing with their personal and family medical history, really hoping to gain a very personalized approach to their wellness journey. At that point, then we'll work with them to put together a lifestyle-based plan, and they'll meet shortly thereafter with our registered dietitians and our exercise professionals to really begin to and I think the crux of this is, to turn data into insights into actions, and actions into outcomes. This is what the Biograph experience is devoted to. It's what it's predicated on. If we can't turn data into health outcomes, then this will really all have been for naught. So we spend quite a bit of time thinking about how to do that.
I think just broadly, I mentioned the landscape evolving, but that seems to be the barrier, right? Or bottleneck, that we have data, we have inputs, we can measure this, we can test that. But on the other side of that, like, what's actually happening? And again, there's lots of different potential solutions there in terms of, do we add technology? Do we add kind of a human and doctor and care team in the loop? Is it both? Do you have like a perspective on that? Like this maybe like bottleneck, and then, hey, how do we at Biograph translate this into outcomes?
Well, and I think, you bring up a number of different points, and I'm excited to delve into this because, as you can imagine, we devote quite a bit of thought to this. I think in terms of currently, there's probably really two approaches. And on the one hand, you have this very personalized, intensive, sort of curated experience, for example, like that a Biograph is providing. And then there's the more sort of mass market solutions to data generation. And certainly our perspective is, we're thinking about, for those individuals who are really looking to sort of redefine their approach to a healthy health span, longevity, looking at how we can likewise provide that sort of mass market solution based on, really evidence-based, actionable testing and treatments to drive those health outcomes. I think you brought up a good point, and you mentioned, for example, wearables, and certainly there are a variety of those out there, sleep trackers, continuous glucose monitors, exercise watches that will give you estimated VO2 max. More recently, you had these very broad-based, expansive blood testing panels, and certainly whole body MRI. These are exciting opportunities. We can gain really sort of previously unobtainable or, data for our use. But, I'll tell you, it's really been sort of my anecdotal experience. And certainly we've had members come in, they generate a lot of data stream from the wearables and from the imaging test or the broad-based laboratory panels. But what we found is it's very difficult to know, what do I do with this? What is the action? What is the next steps? How do I integrate that with my existing health information? And who's my partner? Primary care physicians, I mean, to their credit, they're asked to do a lot of things, and to be able to take wearables data, likewise incorporate this in your typical, healthcare visit is a challenge. And I think within that, there's this sort of unstated assumption that that all data is created equally, that more data is better, and more data equates to better health outcomes. But, I think there's reason to question that. And certainly in our experience, I think technology without context can be noise. And, certainly we've seen instances of this where, I'll give you an example. We've had a number of members who have come in, they've had, sort of the advanced laboratory testing by conventional risk estimates. Their cardiovascular risk, for example, is estimated to be really quite low. But, we go a step further and providing, diagnostics like CT coronary angiography. In these couple instances I'm thinking of, both of these individuals had soft plaque, moderate stenosis in the mid-left anterior descending. And certainly this is we're talking about 50 to 60% stenosis. And certainly this is not an artery that you want compromised. So I think this is like an instance where just having, for example, even expansive laboratory panels can provide, a rather, an incomplete assessment. So I think all of these things have their context, but scattershot or single scope testing oftentimes leaves the potential for gaps, and sometimes important gaps.
Even if we're doing all these things and oftentimes in isolation, right? So you might have, even if I'm somebody, and I am, who's very proactive and fortunate that I can get the MRI and I wear the wearable and then I track this over here, and then I just have all these things in silos sitting around that I'm trying to figure out what to do with. This care team and personalization, and then how it's implemented at Biograph, how do you do that in terms of, even from the behavior change standpoint of, hey, we did all this testing and now we know,
Yeah.
but how do we move you in the right direction? And then when do we retest and all those sorts of things?
Yeah, I mean, you've hit on some really important points here, and it really kind of gets to the crux of many of the issues that we've been thinking about very intensely over the last several years. One way to look at it is let's look at what's the evidence around, sort of what are the primary drivers of chronic disease, morbidity, and mortality. Okay, so you might consider atherosclerotic disease, neurodegenerative disease, for example, emphasis on dementia here, metabolic dysfunction, cancer risk, early detection, and all those things that Biograph will lump under quality of life. For example, VO2 max, aerobic capacity, body composition, muscle mass, and strength assessments and movement quality. It's a useful conceptual framework, but I think the reality of the matter is that oftentimes risk within one domain strongly influences how we think about and interpret testing from a separate domain. So we're really talking about triangulating results, deriving the best insights, and then you have to, to affect behavior change, to really develop a personalized action plan, you then have to take those results and deeply integrate them into the individual's personal and family medical history, their lifestyle challenges. For example, I'm a busy tech executive. I have young children, what have you. Here's what I can devote. Here's what I'm able to accomplish. And then think about, how exactly you'll develop that plan. So our basic framework is to look at diet, exercise, sleep, physical and psychological resiliency, and then supplements and medications where indicated. So I think by really taking a really evidence-based approach to what are the drivers of disease, what is the evidence base, what's the application around these diagnostics, how do I triangulate these results, how do I personalize them to this individual person who's sitting right across the table from me. It's important to take, population level data and then think about how do we apply it to the N of one, which is really what this is all about. And then develop an action plan that meets them where they are, that incorporates, their wellness goals, and then thinking about exactly how we implement that approach on a daily basis. I like to think of, health span or longevity. It's not really a single shot solution. It's the sum total of these daily decisions that you and I make about the foods we eat, the time we have devoted to activities, our relationships, etc. So this is the type of holistic framework that I think becomes really important if we're talking about bending the needle, moving the arc on somebody's wellness arc. Oftentimes, both, people come to us and maybe they have been looking at their watch and they get their estimated VO2 max. And certainly we've seen instances, a number of these, where people will have even an above average or very high relative VO2 max. And this is what's being reported on these devices. But when we undergo, formal, sort of laboratory VO2 max testing, we get body composition data and sort of next step metrics like lean mass index and appendicular lean mass index and grip strength testing. What we'll actually find is that this measure, this above average or high relative VO2 max, is in part arising because of the abnormally low muscle mass. And so, what happens here then is, this is fortune, this is gain. And I love it because people come in and they're active and we can build upon that, right? We want to work with you. And so the takeaway message here is that maybe in parallel with your aerobic exercise, we really want to focus on muscle mass gain and strength. We're thinking in terms of healthy aging and health span. And so when you think about exercise, what you really, I would suggest, is what you want to be thinking about is aerobic capacity, movement quality, muscular strength and endurance, your appendicular mass. And this is the groundwork then for healthy aging. So again, it's where, this sort of single scope testing, I love it when people are engaged because I can work with that, right? We enjoy working with that. But where you have this sort of triangulated data like body composition testing and some of the next step calculations, it can lend a little richer, better insight that can allow you to sort of refine exactly what you're doing in terms of your healthy aging program.
This episode of the Fitt Insider Podcast is brought to you by EGYM. EGYM makes some of the most innovative strength training machines on the market, but that's only one part of their integrated ecosystem. With connected fitness equipment, AI-powered gym software, and a comprehensive corporate wellness offering, it's forging the future of preventative health. Partnering with companies worldwide, EGYM's WellPass program improves employee health by expanding access to premier fitness and health facilities. Upgrading gym floors, EGYM equips every operator with smart equipment and AI tools to create hyper-personalized training plans for every exerciser. Putting it all together, they're transforming healthcare through exercise. Experience the power of EGYM's ecosystem at egym.com. As someone, as I mentioned, who is engaged, I often think, how much time am I wasting devoting my energy to the wrong thing? Maybe I should be doing more X versus Y. And am I getting that feedback loop to know, hey, I'm already taking the time to meal prep and take my supplements and all this. And yes, I get my blood work done, but thinking about those gaps of I'm putting X number of hours or certainly, mental hours into thinking about making sure I'm doing the right things. And then at the end of the day being like, oh, you know what? I should have just been doing X, or I could have done 50% less maybe of some of those things.
The fact that you're doing anything, the fact that you're engaged and really kind of working towards those things, these are positives. And really what we're just talking about is how do you get that next step sort of more integrated, more holistic understanding, and then somebody that can, work with you to turn that sort of that data stream into something that is an actionable outcome that's actually getting you closer to kind of what you're striving for. So don't feel bad. That's not the takeaway here. I love it, and I'm glad to hear that.
Of course, the flip side of that is that as this space continues to evolve, the criticism that we often hear is normal people are priced out. This is only for Silicon Valley. This is only for kind of like the billionaire class, which is certainly not true. And there's a spectrum of these things. But yeah, like a concierge membership is not cheap. So how do you think about that access piece as like just this broader space continues to evolve?
Yeah. So, you're kind of going back to what I said earlier. I mean, I think that's exactly right. And on the one hand, you do have sort of, like I said, these sort of more curated, bespoke experiences like Biograph. There are, on the other hand, you're seeing an increasing proliferation of these, sort of more mass market solutions. And I know from Biograph's perspective, this is something that we're actively thinking about is how do we actually, in terms of maybe these more mass market solutions, what really are the core? What do we think are the essential, the actionable, the evidence-based laboratory studies, these interventions? How can we adequately incorporate things like, bioimpedance scales and home blood pressure cuffs and CGMs? Again, there's a wealth of potential there, but it's really thinking, being very thoughtful about how do we, that noise that exists around that data stream, and how do we actually provide insightful directional information that people can work with to begin to think about how that they can personally apply that. I think there's tremendous potential there. Biograph is certainly excited about it. And this is something that we're actively considering and prioritizing.
So then let's roll that into thinking about how this Biograph continues to grow. So now 2 locations, potentially more in the pipeline, physical locations. But as you mentioned, the opportunity to create maybe a more mass market solution. So do you see that? I guess I'll just leave it more open to you. What does that roadmap look like in terms of how you continue to scale, whether that's physical, whether that's an online platform or digital or telehealth, like all those things are certainly out there.
Yeah, I think the answer is yes. So let me qualify that a little bit. Certainly strategic growth is something that we're focused on. We're looking at an expanded domestic geography, international growth over the next several years. The bricks and mortar to offer this type of, correlated advanced diagnostics is certainly in our DNA. But then, like I said, likewise, we also have this focus about how do we effectively leverage a digital platform? How do we reach out and really assist people? I mean, there's a hunger there, there's a desire, and I love to see it. People are looking for the means to help them redefine for themselves, in a slick, more lightweight solution. How do I go about this business of healthy aging? And, it's imperative that we meet them there.
Going from that place of 2020, one location to now rolling out more broadly and publicly, what were the decision points of like, yes, this has to be physical locations, and then we have to own kind of that whole experience? And not to say that, physical locations, that there's not a human interaction standpoint of maybe doing the testing, because if you look at it now, there's no shortage of, whether it's scans or blood tests, a lot of things are just really a front door to, or a wrapper on top of maybe a Quest diagnostic or maybe an MRI scanning location. And then there's everything in between of sites where you might see someone, but really that's going back to a online experience. So it's touch points in person, but not fully kind of in person. What were that thought process like to say, no, our expansion looks like this. We want to have the diagnostics, we want to have the locations, and then continue to build on it from there?
Well, this is great. So let me back up just a little bit and think and say, along with our focus on the strategic growth in terms of geographies, in terms of that digital growth and platforms and member portals and expanding on delivering a more even high quality and effective telemedicine presence, we continue to think about how do we actually refine, the testing that we're doing. Because the one thing where we really, really sort of see our value proposition is, as opposed to, say, a whole body MRI offering, I can certainly understand the appeal, the value proposition of early detection of preclinical disease. It's obvious. In practice, one must acknowledge that not all whole body MRI programs are created equally. And I think that, at least from, our perspective, is that we really want to think about the whole ecosystem that wraps around it, right? I'll give you an example, at least sort of the way we think about it, and then I'll draw a parallel to how we think about then offering a more mass market solution. So specifically around, say, like whole body MRI, there's not just the particular sequences or the protocols that you use. It's, very conscious decisions around, for us, for example, of using whole body diffusion maps, sort of this notion of diffusion weighted imaging that can complement our more conventional anatomic, T1, sequences. And that introduces time, so on the one hand, it was a conscious decision on our part to really kind of bring this all in-house and not just look at table time, although that's important, obviously, but really thinking about how do we best apply these particular sequences and protocols to really truly help in further characterizing any visceral lesions we may discover. And then likewise, around interpretation, whole body MRI by intention covers a lot of ground, right? So we have a 3-tier radiology interpretation. Every scan is interpreted by a neuroradiologist, a body radiologist, and a third radiologist whose focus is on that quality assurance, and they arrive at a consensus interpretation. Next, that lead radiologist then meets routinely with our clinic physicians, and then we look at what is our members' familial risk, what is their personal medical history, what is their genetic risk, and then correlating the results, other laboratory and imaging studies that we're getting in their Biograph assessment. And then how do I actually report all this data in a way that's readily understood, that can convey our sense of what needs to happen, and in a way that, promotes action and understandability? Because really, when you think about it, ideally, the whole body MRI report has multiple audiences. There's the member themselves, who has to be able to look at this and sort of gain an understanding of what this all means and how I apply this to my life. But ideally, even then, a primary healthcare team. And how do we assure a consistency in communication and action across these various audiences? So this is something that we continually think about and refine. Wellness, by definition, it has many, many audiences involved. And so we need to really think about how we get that message out there cleanly and clearly. And I'll give you an example. We had a relatively young adult member come to us who underwent whole body MRI and had, by what conventionally would be a rather, minor thyroid abnormality. And in particular, when you consider that her thyroid laboratory studies, blood studies were all normal. However, parallel testing by us had established she actually carried a hereditary cancer risk syndrome variant. And so the pretest probability for thyroid, among other cancers, rises dramatically. And so based on that, then we referred her to a tertiary care center for biopsy and enhanced surveillance, cancer surveillance for a number of organ systems. And so this is an example then of how really it's a whole program that you wrap around that scan that I think allows you to triangulate this data and really deliver a value product. So, and I promised you I would relate to sort of how we're thinking about the digital, program. And so I do think that these more lightweight mass market solutions, I think there's tremendous value. I think this is a real need that we need to meet. And so really what we're devoting ourselves to now is not, as opposed to just a very expansive blood panel where, we're, really what is the evidence? What is the actionability for a nominally healthy prevention population that can really truly drive health outcomes while minimizing the noise around these things? False negatives, false positives, gaps in understanding should all really be considered when you think about how am I going to do this?
Yeah, I think the thing that is abundantly clear in the, probably half hour or so that we've been talking, and I've been fortunate enough to host a number of founders and executives from various companies that are building across the spectrum, right, of these and landscape of solutions. And maybe if I were just to encapsulate it, like the level of clinical rigor that you're talking about is far and away different from, maybe other conversations. That's not to speak badly for anybody else, because like we said, each of these kind of point solutions or diagnostics certainly have their place, and anybody kind of moving us more in the path of this proactive healthcare system, in my eyes, is a positive. But you can, at times, when the conversation centers around, we sped up a scan process, or we do it, for this dollar amount, which is cheaper. It's, a lot of the things that may be flashier, but I think, what you're saying basically is like the words, I think it's on the website, or when it talks about the brand, are things like most advanced, most comprehensive. And that's just and then whatever it looks like when it trickles down, right, to mass market, like, hey, what is the thing that is palatable both in terms of price and scale for more people? We'll figure that out. But there is something to be said for, at the other end, maintaining this, whatever it takes, we will go to every test possible to deliver whatever the most advanced and most comprehensive version is.
Dr. T's leadership, as co-founder, is a really emphasis on evidence-based, certainly evidence-informed, and then really thinking about what is the best available evidence for how we motivate and drive behavior change. That rigor, that sort of thoughtfulness about how we triangulate results is very dear to us, and I'm glad that came through. But like I said, we are interested in what that mass market product can look like, and that's why we're thinking very diligently about it, because, like I said, I do respect and I do think this is an area that really demands and deserves attention. We want solutions that are available at every level, and so if it is at least starting out as a more lightweight, for example, perhaps blood testing, panel, can we then deliver a digital solution that sits in parallel to that helps our members think about, here's what this means. Here's what this means for people like me. Here's how I might consider it in light of my own personal or familial health challenges. And most importantly, what's really important to me, though, is, I'm not out here to disrupt the medical home. I'm a big believer in primary care. I think it needs help. But I'm not here to tear it down. I'm here to buttress it. I'm here to do the things that it's not currently able to deliver or do. So to the extent that we can offer this more mass market solution, that we can provide sort of the wraparound education, I really want users to then be able to go to their physicians and have just a really deliberative conversation about what this means and how should I apply this. And I want to make that primary care physician's job as easy as possible. So again, we have multiple audiences that we're trying to meet and address. And, so this is the framework I think that we bring to it. And this is, what I hope to see over the course of the year.
Just thinking about the status quo of the healthcare system, right? Years from costs to outcomes not being great, costs being too high, burnout among physicians, kind of a distrust, or certainly a consumer base who's dissatisfied with the status quo. You mentioned like supporting primary care, like, whereas on the flip side, a lot of people talk about blow up the system, like, being hyperbolic, but also just disrupting it, building something new. Like, if we go with kind of your perspective, hey, let's support the system and give them maybe tools and help them, or take certain pieces of it to make it more manageable. Like, how do we move in the direction of whatever better is, whatever more preventative is, whatever more accessible or more affordable is, without kind of, hey, throw everything away and start over, which isn't realistic?
Yeah. Well, I think that's a fantastic question. And I might even, approach it from maybe like my own transition, I was brought up within this conventional care system. I tried my hardest to excel within it. It was a frame shift for me. I've been doing, more into the proactive preventive space now for just a little over 10 years, but it was a transformation for me, even recognizing the limitations and the ways in which the system was broken, the ways in which the system was underperforming what we all wanted. I would say even for myself, it required a real frame shift adjustment to really understand and, really at a deep level begin to think about what I mean when I say preventative, participatory, proactive care. Apply that to the system as a whole. Boy, that, that's a challenge. So I don't want to blow it up, but I do want to transform it. And I think that the way we transform it is providing actionable support, such that our patients come into those primary care offices, into the conventional care system, and they come armed with knowledge. They come armed with data that was previously unattainable to them, and that we're able to help them drive that conversation around, hey, this is what actual proactive prevention looks like. This is what I'm going to demand. And I think that, we create, certainly the interest is out there. I think certainly the demand is growing. We need to guide this in ways that I think are evidence-based and actionable. And then our patients, our fellow citizens, we all kind of, collectively begin to demand something different. And like I said, I'm not here to create frictions or problems, but I am here to transform the system. I don't want to blow it up, but I want to transform it. That's for sure. And so I think, whether it's Biograph, perhaps leading the way on the more, like I said, curated, elevated experience side, or whether it's these digital, mass market products, I think the potential is there. I think certainly the opportunity is there. It's really what we should demand.
Absolutely. I think, as you're talking, I'm nodding my head, and listeners are probably nodding their head too, that, hopefully we continue to move in that direction. Both a lot of work to be done and a lot of opportunity in terms of, how we get there. We'll actually wrap up and get you out of here on this. As we continue to follow along with what Biograph's doing, and maybe for people who want to learn more, where would you point them?
Certainly our website is probably our first stop. As we said, we have clinics up and running in San Mateo, just right outside of San Francisco, and in Manhattan. So visit our website. We have, enter your query there. If you want to go ahead, this is right for you, you don't have any questions, you're able to go ahead and schedule with us. Absolutely. That is available. If you'd like to have some next step conversations, understand a little bit more our perspective, what exactly our programs look like and what that might mean for you. We have individuals available right from the website that are happy to have that conversation with you. And I would say to, the people out there, if you're ready, we're certainly ready, and we would love to see you.
Perfect. We will make sure everything is easy to find in the show notes, everything along with when we publish this, and very grateful for you making some time today. So thanks for being here.
Thank you, Joe. It was a real pleasure. And I really enjoyed our conversation. I think your questions were, certainly provocative. It's something that we've been thinking about really hard for a number of years now. It's a real pleasure to be able to chat about it with you.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fit.co. And one more thing, you can learn more about our recruiting and consulting services at fit.co. That's FITT.co. I'll see you here next week.